Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. I am super excited to bring you this episode, our second installment of listener questions this season. It's a ton of information, so get out your pens and paper because we are going rapid fire through lots of great information. Oh wait, I did want to tell you to make sure to listen to episode 34. If you have not heard our first installment of listener questions, there's a lot of great info there too. Here we go. Today's first question comes from my oldest daughter, Marion. Shout out to Miss Marion here. She asks, where does cancer go in your body and how does it get to other places? And I just love this question because I think it is so innocent and yet it's a question a lot of people have. And so first I will say it depends a little bit on the cancer. Some cancers spread very quickly and others might be present in your body for years before they ever travel somewhere else. But cancer, unfortunately, can go anywhere in your body, and where it goes is often a characteristic of the cancer itself. For example, GI cancers tend to metastasize first to the liver, whereas a cervical cancer might first metastasize to lymph nodes. And where that first place that it metastasizes to is often the first place that we check to see if cancer has spread. Now, as to how does it get there? I love this question also because we like to think of whether or not the cancer is kind of contained or not contained. And there's really three different ways that cancer can spread. The first is just by growth, by pushing into other tissues. So a tumor that grows in one area can spread out to the other tissues around it. Other cancers spread by spreading first to lymph nodes, so it might actually be relatively small where it began, but can spread to a lymph node. For example, in head and neck cancers, often the first diagnosis is made because of a swollen lymph node in the neck, and it can be even difficult to find that primary tumor. And lastly, we think of cancers that spread through the blood. And those cancers that spread through the blood are often some of the most dangerous because they tend to spread to lungs, liver, bones, or brain more quickly or possibly more frequently than cancers that have a more, what is considered slow growing method. So those are all the different places the cancer can go in your body and how it gets there. Next question from our listeners. How can cancer treatment be tailored to individual patients? And I first want to say every cancer treatment is tailor-made to the individual patient. When we evaluate a patient in our tumor board, we sit down and look at your exact pathology, the grade of the cells under the microscope, the size of the tumor, the grade of the tumor, the anatomy surrounding the tumor, what tissues might be involved. And in addition to that, we speak about your individual risk factors and what you bring to the table, meaning how is your energy level? What is your nutritional status? Are you able to come in regularly for treatments, or would a treatment that occurs every few weeks make more sense for you and your situation, both financially and logistically based on where you live in relation to the hospital? And it's not to say that we recommend different treatments for different people, but we want to optimize all of those things so that you get the absolute best treatment for you that has the best chance of success. Another way that we have talked about individualizing care to patients, on a recent episode, we discussed precision medicine and looking at the actual genetics of the tumor itself to determine the best drugs or the best combination of medicines that can be used for that particular patient's cancer to get the right combination for cure or long-term remission. Oh wait, I did want to tell you, a tumor board is when the group of doctors, the radiologist, radiation doctor, and chemotherapy doctor, as well as potentially a surgeon, all get together to discuss each individual patient's case, pathology, images, and any other relevant features in order to make a treatment plan. Next up, what is the most successful form of cancer treatment? And of course, as a cancer prevention doctor, I love this question because the most successful is prevention. And that means getting your cancer screenings on time, getting any cancer prevention methods like having your genetic screening if necessary, having recommended surgeries, having recommended vaccines, and even going so far as to make sure that you're getting the most up-to-date prevention information. So, for example, we do recommend the Pap test, but we also recommend the HPV test and the HPV vaccine. We do recommend quitting smoking, but for smokers, we also recommend a yearly chest CT. And you can get more information about these cancer screenings at any cancer prevention website to get a list of what cancer screenings you qualify for, but stay up to date and ask your doctor to make sure that you get those cancer screenings on time. Y'all will love this. Our producer generated the next question using ChatGPT, the new artificial intelligence tool that's breaking the internet right now. How has technology changed the way that cancer is diagnosed and treated? You know that we've addressed this on almost every episode, and there's some really exciting things coming down the pike in terms of cancer diagnosis and treatment. First, we'll talk about the changes that have occurred in radiation treatments lately. It is much more precise, it is much less toxic, and it is becoming ever more so as we move into the 21st century. So it is important to ask, how old is the machine that you're being treated on? And what new technologies is your radiation oncologist incorporating into your cancer treatment to minimize those long-term toxicities? Next, I'll refer you to the episode that we discussed precision medicine, and that's the word we use to say that your tumor is precisely genetically profiled and that we use that information to choose the drugs that we will give you that we know your tumor has a high chance of responding to. And this is being used more and more every day to treat cancers in men and women across the board. And the last thing I want to point you to is liquid biopsy. We are in the infant stages of what we can do with blood tests of DNA, both for cancer screening, cancer diagnosis, and I suspect we're soon going to be using it for cancer treatment and determining the efficacy of our cancer treatments. So stay tuned on liquid biopsy, but there will be more on that in the years ahead. And lastly, I want to talk about the implications of screening. As there are new technologies available, the screening tests are getting better and better. I mentioned it earlier in this episode, but stay up to date and make sure you're getting the most advanced screening technologies. Another one that we haven't talked about, 3D mammogram instead of 2D. And for those women who are at high risk for breast cancer, an MRI instead of just a mammogram. So really think about what is your individual risk, what are the best tests out there, and make sure you're getting all of the new technologies that are available to you. And let me reiterate, ask your physician about these new technologies and what might be the most important for you. This is a question that I wanted to add because I wish more people asked about it. What are the psychological supports that are available for cancer treatments? Too often, this is the harm or the wound that is not seen in the office that maybe either the patient, the caregiver, or the physician doesn't feel that they have the time to talk about, and yet it can be the most important thing. And we know that psychological distress comes in all different forms. It's not just emotional distress, fear, anxiety, depression, etc. There can be financial distress, the actual distress of symptoms that maybe are going unmanaged. Real stress like housing insecurity or food insecurity. And I want to encourage you as caregivers, as patients, as people who know cancer patients, to bring these to your cancer team. They have resources available across the board. We've mentioned some of the many resources that connect to cancer centers across the country to bring these things to cancer patients and their caregivers. So you want to ask for a social worker in particular for those real stressors like your home has recently been damaged in a storm, or you lost your job related to your diagnosis and you're unable to pay your bills. These are real things that you can bring to the social worker at the cancer center and get real help, financial help, food in a box, etc. So definitely bring these to your cancer center. The next stress that I really think about is an untreated symptom. And we have so many options in supportive care. Don't think that there's not a good time to talk about this. There's always a good time to talk about the fact that we've given you 3 drugs for nausea and it's still not better, that we still are not treating your sleep, that your legs are still moving too much at night and you can't rest. These are all things that are really important, not just to your physical well-being, but to your actual survivorship from your cancer. If we can't get good nutrition, if you can't get good rest, these play into your likelihood of remission. So they're all important, and we want to get you the best supportive care. We talked about real financial support, and then on to the emotional support. There are support groups at our cancer center and many others. We currently have active support groups for breast cancer and GYN cancer. We are in the founding stages of support groups for colon cancer and for grief counseling for caregivers. And there are so many others that we just want to point you to, and know that patients, people who've been patients, people who've been caregivers, can often provide some of the best, not just support, but real information about what worked for them in the same scenario. To that end, so often a patient mentor can be an amazing, both physical and emotional support for someone going through a diagnosis, someone who's been there before. And even if they don't have an official patient mentor program like we have at MCI, you can often say, hey, have you treated somebody with this before? Would they be willing to talk to me about what I'm going through? And those opportunities are fantastic. There's a lot of these opportunities on Facebook to connect with cancer survivors in your cancer genre. And lastly, there are the real attributes of psychologic support that we know about: therapy, psychologists, and psychiatry for medications to treat anxiety and depression. These are so important to make sure that these symptoms are treated, because that too plays into your survivorship, to make sure that you live a whole and fulfilling life at the end of your cancer treatment journey and on into your survivorship. I would say that actually just listening to this show, I hope you find that it provides you with support and information that helps lower your distress. Next, if you know someone who needs the information in this podcast or needs this level of support, we ask you to please share the podcast with them and help them to get this information as well. In that vein, I would refer you to episodes 12, 15, 19, and 36. All deal with different aspects of the psychological effects of cancer treatment, as well as the support, both physical and mental, for patients and their caregivers, and really how to support someone in this journey. So I hope you'll find better information in those episodes and keep coming back to us for more support. Ooh, I really like this one. One of our listeners writes, are there any home remedies for cancer patients? So first, I would say yes and no. There are home remedies that advertise as a cancer cure. And please, all of you out there, have a healthy dose of skepticism for something that promises the moon, costs an arm and a leg, and yet does not provide you with any people to interview or speak with who've had it. So I continue to support a combination, as I do for all of my patients, a combination of Eastern and Western medicine to really provide a holistic approach to cancer care. And what I mean by that is, please see a cancer doctor, come to a cancer center, and be offered the best of what modern medicine and science have to recommend to you in terms of your individualized cancer treatment. And then, in addition to that, there are so many ways to have a holistic approach to your cancer treatment. First, a lot of people find things like acupuncture, massage, physical therapy to be incredibly helpful, both for the side effects of cancer treatment as well as in recovery. Second, there are some safe over-the-counter medications which can help to alleviate many of the symptoms associated with cancer treatment, but we want you to be very careful and speak with your doctor and your pharmacist about any additional supplements that you might be taking. For example, I ask my patients to avoid the high antioxidants during cancer treatment, like vitamin C and vitamin E. This often means actually avoiding a multivitamin during their actual cancer treatment, but these things are okay to take after you've finished your therapy. There are some supplements which might be good for one thing and actually cause a side effect that could be very detrimental in another way. The last thing is I'm going to give you some quick and easy tips that I give my friends when they call me on the phone late at night and say, what can I do till I call my doctor in the morning? Remember, 2 extra strength Tylenol is not going to hurt your liver. It's not going to hurt your kidneys, and it is a fantastic pain medicine. We give this to patients IV while they're still asleep in the operating room, and it does wonders to reduce the amount of opioids that they need. Next, if you want the prescription strength ibuprofen, not the regular strength, all you have to do is take 3 or 4 tablets instead of 1. But only do this once before you talk to your doctor about it. We have to individualize the ibuprofen treatments because this one can harm your kidneys. And we want to make sure that you aren't taking either of these very high prescription strength doses for very long periods of time. But 3 ibuprofen and 2 Tylenol in the middle of the night will go a long way to getting you to 8 a.m. and your doctor's visit. Next, if you cannot sleep, particularly if you can't sleep and are so nauseated, 1 or 2 Benadryl in the middle of the night could go a long way to helping you with that. But Benadryl is not to be used in combination with alcohol or narcotics because it could cause excessive sleepiness. Those are just a few of the things that I use to help my friends get through the night until they can see their doctor in the morning. And I hope they help you too. Let me just give a short disclaimer before this next question. We are going to be talking about a very adult, important component of survivorship. And if there's young listeners in the car, you might want to drop them off before you listen to this next question. I did want to talk about sex after cancer. I get this question all the time as a GYN cancer doctor and also at cocktail parties, but only after a couple of drinks. So first, I will say that the sex after cancer is going to closely resemble the sex before cancer. So if there were some issues there, emotional or physical, unfortunately, they can rear their head again. And there are a couple of things that I would say here. Men and women differ, and I'm making big generalities here, so please allow me a little bit of room. But, for men in general, their sense of physical well-being is tied to their sex life, and often having sex creates a sense of physical well-being. And so is often something that happens maybe before or as a way of becoming physical well. And so often for women, sex is a result of being physically well, of feeling physically well, feeling healthy, feeling whole, feeling sexy. And so there can be a lot of friction here, and I help a lot of couples to overcome this. Forgive me, I usually am helping on the GYN cancer side, so I am going to talk about that first. When we think about a woman recovering from cancer, and I deal a lot with breast and GYN cancer patients, so often these are women who are now postmenopausal or newly postmenopausal who are trying to reinvigorate their sex life. And the first thing I say to my couples is a woman's sex organ is the brain, that you really have to reestablish the connection between the man and the woman or between the two partners, if we're talking about men or women and women, but to really reestablish the connection. Go on dates, hold hands, kiss while you're still standing up in the kitchen. All of these things really just help you to reestablish that you're together in this and that you love each other. You're not just roommates. The physical touching, all of that really plays into it. And then I really encourage people to get in the bedroom and work on foreplay with an expectation that you're actually not going to have sex that night. Just take the pressure off. Just have fun. Add toys or lubrication. Really just get to know each other's bodies again and take sex off the table. And that really allows people to not be under so much stress or anxiety. Is it going to work? Is it not going to work? Is everybody going to have a good time? And just enjoy each other. I always say go back to high school. And if that means you need to get in the backseat of the car to have a good time, you do that. You do you. And then when you're ready, when you know that everybody's going to have a good time, then you get back to actual sex, whatever that means for you as a couple. And also remember that whatever amount of times or days during the week or days during the year that you are sexually active, whatever works for you as a couple is the right choice. There is no right answer, and definitely no need to compare yourself to the person on this side or that side of the street. So please keep that in mind. And lastly, I will say on the men's side, for men after cancer treatment, in particular after prostate cancer treatment, but after a lot of cancer treatment that can affect both psyche as well as physical function, that impotence can be a real issue, and it's important to discuss with their doctor. There are so many options now for men, and making sure that everybody knows that that's totally normal, that it is a natural part of going through this process, and it does not have to be permanent. And always, always, always bring these issues to your physician, to your nurse practitioner, to your supportive care physician, and make sure that they are aware of your needs and help you to work through these problems. I always say to my patients, having a great sex life is part of having a great life after cancer, and it's important enough to work on. So make sure it's part of your survivorship plan. For all of you out there, I just want to say thank you for a great season. Thank you for listening. Thank you for bringing us your questions, and for those who helped to put together the answers. And remember that your questions don't end just because it is the end of this episode or the end of this season. We know you have questions all year long, and we ask you to bring those to canceringshow.com or to usamci.com and reference the Cancering Show, and we'll get you the answers that you need. And just as an aside, I can't thank you enough for your support of the Cancering Show, and we hope that you'll continue to spread the word and to get this podcast into the hands of people who need more information about their cancer and want to come to a cancer appointment armed with information and ready to ask questions of their team. And most importantly, for those of you who are cancering or supporting someone who's cancering, we see you, we hear you, and we're here for you. And remember, cancering affects us all. Thanks again for listening. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.